Good afternoon, ladies and gentlemen, members of the press corps. Thank you for coming to join us this afternoon to discuss the report on the analysis of arsenic in nail clippings, soil, food, and water samples from the Cayman Islands and the health implications, produced by the International Center for Environmental and Nuclear Sciences in collaboration with the Pan American Health Organization. Before we begin or give you an opportunity to hear from our distinguished panel this afternoon, I think it would be appropriate for me to give a brief background as to how we've reached here today. As many of you will recall, post-Hurricane Ivan, the government engaged with MC Restoration to identify some debris management sites to help to collect some of the debris that was strewn around the Cayman Islands in the roadways as an emergency measure. And a parcel of property, privately owned property, was identified in the Frank Sound area for one of these temporary debris management staging areas. As it turns out, there were some concerns raised by various government departments, regulatory bodies, about the potential for arsenic exposure due to the pressurized treated lumber, which would have been shredded and curtain burned at the potential site. And so, as a result of that and some ongoing discussions with the families upon me taking up post as Cabinet Secretary in 2013, I realized that in discussions with the families that there were some outstanding concerns with the cleanup of the site, and the whole issue of arsenic came up a few times in conversations. After discussing that with the families, I reached out to the Public Health Department, which was then headed by Dr. Kiran Kumar, who was, to his credit, while he was very close in actually the last week of his term at Public Health, he immediately reached out to the Pan American Health Organization to seek assistance in how we might go about investigating the levels of arsenic that could be or potentially be on that piece of property. And PAHO immediately that week sent Dr. Mung, who's to my left, to Cayman for a site visit. Dr. Kumar immediately after retired and was succeeded by Dr. Williams, who is here with me. And he has worked with PAHO in coordinating the report and the research that has been conducted by the International Center for Environmental and Nuclear Sciences. So we have with us today a very distinguished team from ICENS. Some of the individuals were here during the time in which the samples were collected and helped to guide the conduct of the study. And so we're going to give you an opportunity to speak with them, but I would like to turn it over to Dr. Williams because in our view, this was the primary concern for us has been a public health concern. We wanted to ensure that the individuals living in the areas were not being exposed to arsenic. And so the Cabinet Office has more or less turned it over to the Public Health Department to guide the process in conjunction with the WHO, PAHO, and ICENS. So, Dr. Rodriguez.
All right. Thank you, Samuel. And thank you, everyone, for being here and welcome. As Samuel has said, I'm Dr. Samuel Williams. I'm the Medical Officer of Health for the Cayman Island. I'm going to start by introducing the members of the team that we have here from PAHO and ICEN, that we have worked very closely with them in order for this investigation. So I'm going to start on my left with Dr. Malcolm from PAHO office in Jamaica, and also Dr. Mong from PAHO office in Jamaica, and they work under the direction of Dr. Jack, who is the representative for this region, and she has been in the Cayman Islands as well as part of this discussion. And to my right, I have Dr. Adrian Spence from ICEN and Mr. Johan Antoine from ICEN as well. So we're very grateful for the team, not only for being here now, but for all the work that has carried out during all this investigation. As Mr. Rose has spoken, the main concern for us was the health of the family in that area and make sure that any potential exposure to arsenic had not have any health effect on them. And we are happy to report with the investigation that we have done so far that there's no, at this point, there's no health concern due to the results that we had find no sign or symptoms of related to arsenic, to chronic arsenic exposure, and neither the levels of arsenic that was found on the individuals were high enough to cause any health concern. So that is important for us to know. As you can see, because the report was made available to the media yesterday, you have seen in the report that this is still an ongoing investigation when it comes to the environmental samples. For the biological sample and for the health of the population, we are confident to say that we have no concern at this point that the individuals potentially exposed to arsenic have been affected by this incident. The investigation on the other environmental samples, like I said, are ongoing, and as soon as they are completed, we will be happy to share with the family and with the media. It's important also, I'm not sure if there's any questions, we'll be able to ask questions to us, and we'll be willing to respond to the best of our knowledge. But keeping very in mind that this report we are sharing it at this stage because the family were concerned about any health implications, so we want to make sure that the family and the population know that there is no health concern related to any potential exposure to arsenic at this point. And the majority of our discussion at this point, I will ask to be around the health implication because that's the part of the report that is completed at this stage. And as you can see in the report, there's still some environmental results to be completed, and we're expecting that to be anticipated to be completed by the middle of December this year. Not sure if we can open the floor and if you want to ask any question, or before that, actually, we'd like to ask my colleagues at PAHO and then at Eisen to say a few words because they have been involved in this investigation from the beginning. So I'm going to ask Dr. Mong, you can please say a few words. I don't think.
Good afternoon, everyone. Very happy to be here representing the Pan American Health Organization, the World Health Organization. I come here together with my colleague, Dr. Taralyn Malcolm. She is responsible for sustainable development and environmental health. I am responsible for disease prevention and control. We have been here since June when the first visit was made, as mentioned by both Mr. Rose and Dr. Williams, and this is jointly our third visit. Our head of office, Dr. Jack, as mentioned by Dr. Williams, has also been here. Just to reiterate the point made by Dr. Williams, that the overall findings suggest that there is no health concern in the level of arsenic found in the potentially exposed group. Just want to reiterate that point. The second point would want to reiterate is that the findings does not show any signs and symptoms of chronic exposure. So these are the two main points we would like to reiterate. I don't know, maybe if Dr. Malcolm might want to add something more. Just want to pass on to her. Thank you.
Good afternoon. Just to add to what Dr. Mong stated, from the start, we have to look at the fact that arsenic is a natural component within the earth crust. So we cannot expect to find zero levels in any product, in any item. Persons are exposed to arsenic through their daily activities based on the type of food that they consume, such as the seafood, such as rice, and also even within our soil, naturally, it is found. So when we look at the results and we try to interpret the findings, we have to do so within the context of that information. It's also important to note as well that there are certain activities that increase the risk or increase the level of arsenic, and one such is smoking. Another is in terms of fossil fuel, burning of fossil fuel. So there are other environmental exposure that occur naturally that will result in individuals having certain level of arsenic in their body. So while we interpret these results, we have to keep that information in mind.
Right. Thank you, Dr. Malcolm. Dr. Spence, you want to say a few words?
Afternoon, Adrian Spence, research scientist in iSense, and I'm also the head of the Spectroscopic Solutions Laboratories. I'm a geochemist by training, environmental and analytical chemistry. It's my third visit related to this project, and I can say that as an international institution, we're actually very happy to be a part of what is happening here in terms of investigating the problem and providing potential solutions. iSense is primarily engaged in environmental geochemistry. That is, we look at the presence of heavy metals, trace elements, some people may call it, in the environment. My first trip was basically to sort of guide the process of sample collection. And then there was a subsequent trip in which I assisted in actual sample collection, sort of preserve the integrity of what was going on. And then samples were actually sent back to Jamaica for subsequent analysis. And my colleague and I, Johan, very pleased to be here to take whatever questions concerning the technical aspects of sample treatment, sample handling, sample analysis, etc., and maybe even the interpretation of some of the data. But a few things that should also be kept in mind is that what we're looking at here are total levels of arsenic in the matrices that we have looked at. What is important when you're looking at arsenic is to make the distinction between what is organic and what is inorganic arsenic. The inorganic form of arsenic is what is considered the most toxic, and the inorganic form has two different components. There's what you call an oxidized form and a reduced form. And the reduced form is the more toxic form. We haven't had a chance to look at the different components or the different chemical forms of arsenic, which is another ball game. But what we have provided here is total levels. And even then, there's nothing to suggest that there is any risk to either personal health or to environmental health. So there's no ecological, what we consider ecological toxicity, or there's no risk to human health. I think that's all I'd like to say at this time. I don't know if Johan would like to contribute anything.
Good afternoon, Johan Antoine, research scientist and head of the Nuclear Analytical Lab. As Adrian said, and he said most of what, I think he's covered most of what I would say. This is my first visit here, and as Adrian also said, we're happy to be here. Some of the results, actually, most of the results that have been provided thus far were provided from my lab. We're happy to use some of the techniques that we have available at iSense to tackle this investigation, I'd like to say. I think, as has been said before as well, this is ongoing, so there are other samples to analyze to see if we can get a more distinct picture of what we're looking at so far. But I think I would venture to say I don't expect that anything will change significantly. I think that what has been said before is the case. There is no evidence of any real toxicity to either the citizens or any of the environmental samples. I look forward, as Adrian as well, to take questions that may be posed to us. Thank you.
Right, thank you. I just want to, before we go to the question part, to thank and show our appreciation to other agencies from the Cayman Islands that have been involved in this investigation and other departments, including the Water Authority, the Ministry of Agriculture, also the Department of Environmental Health. I also want to thank the Ministry of Health and the Chief Medical Officer for their support during all this process. So, I said that you can please ask your questions, and would probably prefer if you ask all the questions, or some question we'll write it down and then we can start responding to question one by one. So, Mr. Stone. Yes, sir. Go ahead. Yes, Mr. Stone. Yes, go ahead.
One of the concerns was that this potential contamination had occurred so close, which is to say within about 500 feet of Clifton Hunter High School and 850 students that started school back in the first week of September. Was there any conclusion or testing done on the Clifton Hunter environment, soil, groundwater, and was any conclusion reached about that?
Yes. So if you guys would prefer, then I guess we'll have to go along and answer the question, and then we'll move to a different question. Yes, the answer to that is yes. There were testing done, Clifton Hunter, environmental testing done, and the result are back, and they didn't show any high level of arsenic in the area exposed. So there's no risk at all for the children and the staff at Clifton Hunter School.
Yeah, just to add to that, if I may.
Yes, sure.
Yeah, the result that we saw for arsenic in soils from that particular area was actually one of the lowest. Yes.
Any other question?
Hi, it's Wendy here from Cayman News Service. I think this is really a question for Mr. Rose. Obviously, a lot of this issue has to do with the owners of the land that had concerns about their land being cleared up. Given how this looks, that there isn't any serious potential, will government now still be involved in any kind of post-cleanup, or will you be leaving it up to the landowners to now deal with, now that you've established that there's very little contamination there?
Thank you, Wendy. Well, government has been involved and will continue to be involved in more than one way. The report alludes to the need for continued tests. We're going to do follow-up tests in the future. So we made it very clear to the families in meeting with them this morning that because this stage of the report has been completed doesn't mean that we're going to now abandon them. The cleanup aspects have been ongoing. We have been working through the Department of Environmental Health to pick up any debris that was remaining on the site. And the Water Authority, which is also in the room represented here, have been continuing to monitor the monitor wells that are on the site there. So by no means with this report being completed are we now going to just walk away from the families, and we'll continue to engage with them and have ongoing discussions with them going forward. Andrew.
Andrew Harsh with Cayman 27. I guess this is for these gentlemen here. A while ago you said that you found the results, or the results were back for a select group of samples. What percentage of the samples do we have results for? And what's the outstanding numbers like here? And also, I would like to know what, for the group of samples that you did find the results with, was this the easiest group of samples to process? Do we still have like a significant backlog with more major samples that might reveal something else? What's the current state like as far as that's concerned?
We completed all the biological samples, as in the nail clippings. I think what we have, I'm sorry? And all the food samples. What we have outstanding are soil samples. I think we've done about 66-70% of them, if I have my math correctly. So it wasn't a matter of ease of sample preparation or anything like that, because because when it reached the lab, there was no, I said, the analyst is blind, so to speak. There is no determination to a great extent about what we were doing. We just processed as we received, and when we had to shut down our analytical equipment, because that was an issue in terms of the timing, and that's the real reason we weren't able to complete. It's because using the technique that we wanted to use to give you the most accurate results, that technique had to be shut down for a totally unrelated project at iSense. We weren't able to complete those samples. As soon as we start back up and commission our technique, we will continue with those samples.
And just a follow-up to that question as well. You say this is an ongoing investigation. Is this still the early stages of the investigation? How long is this process expected to take? And do we expect to see any differing results at the end of the investigation?
Right. I just want to follow up to the first question by saying that we actually asked ICEN and PAHO to give priority to the biological sample because our first and major concern was and still is the health of the population, of the families. So that's why the focus initially was on the biological sample to make sure that we have that result. To your second question of this is an ongoing investigation. I don't think we're at the early stage. We're actually at the final stages of this initial investigation for the samples, environmental sample to be completed, and we're looking at middle of September, December, sorry, to have those results. The middle of December to have those results back. At that time, we'll be able to make a full assessment of the environmental. To answer your question, we don't expect any different, but we have to wait for the result to have any confirmation on that. I have to reiterate what Mr. Rose said, that this is not something that we met with the family this morning. I will make it clear to them that it's not, okay, this is the result, you're now your own. No, we still be looking out for them. They all have access to me at the hospital to come ask questions, discuss, and also as recommended by PAHO and WHO, we will do follow-up, medical follow-up on this patient just to make sure that nothing is happening at this time.
And if I may again, please.
Sure.
With respect to how long it will take to complete the analysis, has nothing to do with the difficulty of it or the number of samples to be done. It's just rather the technique. So the reactor will have to be recommissioned, and Johan could speak more clearly to that. And all of this takes time.
I guess my final question, I'm not really sure who will. I guess Mr. Rose would be the one to answer this, and I'm not sure if he will, but still ask. The issue of compensation, since there's nothing life-threatening, are we looking at a mere matter of thousands or tens of thousands, or what is government facing as far as the bill is concerned here for compensation?
Well, I think you answered your question a bit earlier. It wouldn't be possible for me to answer that today. There's obviously a legal discussion that has to go on between the potential complainants, because we have not received a official bill, as you referred to it. So it's something we'll discuss in the future. Thank you.
Any other questions on that? Yeah.
The report said that there were 2 persons found with elevated, I guess it was arsenic levels. Could you name the 2, and what will happen to them? Are they getting special care, special attention? What happens to these 2 particular individuals?
Well, I think the answer to the question, starting, of course, we won't be able to name the 2 individuals. Actually, there were no individual with levels high enough to cause any health concern. So there were some individuals with higher levels when compared to the control group, but not at the level that would cause any health concerns at all. So the management, the further management for this patient is the same for the whole group. We will follow up on them and make sure that there is no any health indication of any of concern for us.
just a quick follow-up on that. Did either of those two smoke?
Some of the individuals from the families are chronic smokers, and as you may be aware, chronic smoking is related to an increased level of arsenic.
The original Water Authority report mentioned also that they had found traces, and it was merely traces, not overwhelming amounts, but traces of, I think they said chromium, lead, and benzene. What did ISINs find according to those? They aren't mentioned anywhere in this report.
Right. I think Eisen would be the best to answer to that, but remember that this investigation was focused on arsenic, but Eisen can answer into that in more details.
But I think what I'll say is that initially what we wanted to do, especially with the time constraints that we had, was to focus on what we thought was what I would call the potential smoking gun, and in this case that was arsenic. We still retain the possibility to look at some other elements, including chromium as well as copper. We do not do benzene at ISENS, so should that be a consideration, that will have to be analysis by another laboratory. But we thought first and foremost that because biological samples were the priority, and also arsenic was looked at as a target, that we needed to complete that first, and to look at that first before we decided to put any emphasis or priority following that on what could be associated elements.
Thanks, John. All right. Any other questions from the media?
Rory from Cayman Reporter here. I was just wanting to ask, so looking at the general levels of arsenic in the land, you've said that it is approximately the same as just general earth crust levels in this area.
Yes.
Yes.
Yes. You can
so
see it. Yes,
the two people with above average arsenic exposure, or will they? Is it a case of them, if they were to stay in the land, would there be further problems for them down the line? Should they stay there for long term? Should they move, or is there any concern on that front whatsoever?
Yeah, we want to reiterate there is no concern at all about the health of these individuals. And as I said, it's an ongoing investigation. We still have to complete the environmental samples that are on the lab. We are actually looking at probably do controls in some other areas in the Cayman Island. But at this point, we don't have no concern for the health of the individual that will be affected now, or neither concern that could be affected in the future with the levels that we are finding so far.
I promise, last one.
You can go ahead. No, we're okay.
Mr. Rose, you referred to, and I appreciate you can't go into the details, but you referred to some kind of talks about compensation, perhaps remediation. So there is consideration being given to that, and there are talks in that regard. Is that correct?
I couldn't comment on that at this time.
Right. Any other questions? No? All right, if it's no other question, I want to reiterate my appreciation for you guys for being here, and also to the PAHO and the ISEN team, also to the cabinet, since for the first time since the public health was approached about this, we took it very serious. We have been in conversation with PAHO and ISEN team at all high levels, also with the input from the Chief Medical Officer for the Cayman Island and the Ministry of Health and the Cabinet Office. So this we have put, and we have been in constant communication with the family. I know sometimes we get impatient because of the result take a time, but like Dr. Spence explained, it takes some time for this result to come up, and we want to do things as per protocol, as per guideline. Things need to be done properly, so we have a accurate result, and that's why now we're standing here. We are confident to say that we have no concern at this point regarding any influence of this possible exposure to arsenic to the health of the families that live in the area. So I want to thank everyone. I'm sure members from PAHO want to say for some final words, and then.
We're very happy for this technical cooperation with the government of Cayman, and we look forward to this continued work together with ISINS as well. Based on the discussion so far, as you know, we don't have any background profile in terms of the soil. So while we're comparing this area with a small section of the country, we don't have the bigger picture as to what is the profile throughout the island. And I think it's when you get to that point, then you can truly speak with some level of confidence as to what truly is the result throughout the island. When you go through the report, you will recognize that there are different standards that are used, and this is because in different countries, in different regions, based on the levels that they have, their standards varies. So what we use for Cayman was very conservative. We used those that were at the lowest because we did not know what is the background profile for the soil here. So as we move forward, we will continue this technical cooperation with the government of Cayman along with the ISINS team. And at that point, then we can speak with more confidence as to the true profile for arsenic and, if possible, for other heavy metal in the soil here. But I really want to thank Dr. Williams, Mr. Rose, for inviting us to be part of this, and we look forward to further collaboration.
Yeah. Following up on Dr. Malcolm's comment, we really are very happy to be working together with ISINS in this issue, hand in hand with the government of Cayman. We as a health organization, we are the oldest public health agency in the world. We do have a lot of expertise regarding the health of the population. And as mentioned by Dr. Malcolm, the levels differ even within a continent. In this continent, we have certain countries that have very high levels. So just want to reiterate that point. The second point, we are the specialized agency for health for the United Nations. So our inputs is on the health component, and we reiterate our commitment towards bettering the lives and well-being of the population of Cayman. Thank you.
Thank you, Dr. Mann. Dr. Spence or Johan, want to say final words?
No final words from me.
Johan?
So, the only thing I'd like to add is that I think, and I think I can speak for Dr. Spence as well, that we're always happy to be able to use science and technology, especially our own analytical techniques, to help our regional neighbors in any issues or any problems that they may have. And that has been, I mean, my personal pleasure. I'd like to say it's been the same for the Director General and Dr. Spence. We look forward to continued collaboration.
Thanks, and we do appreciate all the work that ISA has put in. So, Mr. Rose, any final comment?
Well, I simply would like to, again, on behalf of the Cayman Islands government, say thank you to PAHO and ISINS for their attentiveness, for their care, for their support in this matter, and for their direct approach with the families. They've been in direct contact with the families, met with them throughout the process, walked them through, engaged with them, because as we all can imagine, the reason why we've taken this approach is because we accept the fact that this could happen to any of us. We got in this situation not because of anyone's fault. This is harking back to the days after Ivan. This was all done out of desperation. We were in very different times back in September 2004. So no one intentionally created this potential exposure at this particular site. And so putting that aside, we have a problem. So how do we address that problem now? And so we reached out to the best individuals we possibly could find within the region, and they have come forward to support the families. And we accept this could happen to any of us. And so, we've taken a very responsible approach in handling this. And I would like to commend Dr. Williams again for his handling of this matter as well. Again, he's made himself available to the families and to all the other agencies, Water Authority, the Department of Environmental Health. This has been a cross-government approach to address this. So we're hoping that come December, when the final report is received, we'll be able to again revisit this and potentially have the team come again to answer any questions the family may have and you as media may have. So thank you again for your assistance and for your patience throughout the process. I've been in contact with each of you individually in the media, and I thank you for your understanding as we work through this very new process for us. Thank you.
Thank you. Thank you, everyone.